Welcome to the Coping Podcast, where we share strategies for coping with the stressors of life, especially the difficulties of parenting. And here is your host, Dr. Lee Weiss.
This is Dr. Lee Weiss. I am the host of the Coping Podcast, where I feature top experts on topics like raising healthy children, parenting, and so much more. Past guests include Dr. Emily Lieberman, Dr. Doug Bolton, clinician Ben Kessler, and many more.
Just a quick disclaimer, the information provided is for educational and informational purposes only. This is not intended to provide mental health treatment and does not constitute a client-therapist relationship. The information provided is not a replacement for being assessed and evaluated by a licensed professional and is not intended to replace mental health or medical advice.
This episode is brought to you by Coping Partners. Coping Partners is a mental health practice in the Chicago suburbs dedicated to helping children, adolescents, and adults. We help manage various challenges, including anxiety, divorce, behavioral issues, relationship problems, and much more. Check out more episodes of our podcast and our website at copingpartners.com, and you can contact us with any questions you have. Before we dive into today's topic, I wanted to introduce today's guest, Dr. Jordan Teitelbaum. Dr. Teitelbaum is an ear, nose, and throat doctor and works at Ear, Nose, and Throat Specialists of Illinois. He is board certified in Otorhinolaryngology and head and neck surgery. Dr. Teitelbaum was born and raised in the Chicago suburbs, attended the University of Michigan, go Blue, went to medical school at Touro College in New York City, did his residency at Ohio University and his fellowship at Duke University Medical Center. He was one of the youngest inductees ever as a fellow in the American Rhinologic Society. Dr. Teitelbaum has also presented and published at multiple international meetings. He has an interest in treating hearing loss, frequent ear or tonsil infections, voice, swallowing, reflux issues, and thyroid and salivary gland conditions. Aside from these impressive credentials, I can attest that Dr. Teitelbaum has an unmatched bedside manner. He views the practice of medicine as a partnership between patient and doctor, where trust, thoughtfulness, and listening are essential. While he works with both pediatric and adult patients, I have seen him personally engage kiddos in his office in the most natural and endearing way. He really gets kids and puts both kids and adults at ease right away. He also has his own family, a wife and 3 kids, and he roots for the Bears, Bulls, Michigan football, and Duke basketball. He also enjoys theater and musicals, reading, exercise, skiing, hiking, and the list goes on. So thank you so much, Dr. Teitelbaum, for being here today.
Sure. Thanks for having me.
Absolutely. Can you share a little bit about your background and how you got into this line of work?
I knew I always wanted to be a doctor. I was the oldest of 3. I feel like I always liked taking care of kids, and my pediatrician was old school in a world when probably all doctors writing on paper charts were old school and like shelving them in the attic. I knew I was like taking care of people. Once I got to med school, I knew I wanted surgical specialties, and I really liked ENT. We see NICU babies with breathing issues, and of course, I see teens and children and people of all genders. People of all conditions, someone essentially healthy, but they have like a little crooked cartilage and they're not breathing well on one side versus like tracheostomies, had neck cancer in the hospital, all the way up to I have so many patients in their 80s, 90s, 100s who they just come in every 3 to 4 months. I clean the earwax out, they get their hearing aids adjusted with my like high level audiologists, and they're probably the happiest people I see on a week to week basis. Wow. So just like being there for them, doing little procedures, a lot of these specialties are really competitive lately. So like getting in early, demonstrating interest, putting yourself on record in terms of publication and rotations, that was really important. And I'm loving it. I'm 5 years out of fellowship.
Well, you can tell that you're passionate about what you do. And like you're saying, I mean, you do kind of like you're describing little things like the hearing aids and things like that, which are not so little when you're someone who, is having difficulty hearing as an elderly person, let's say.
That's true.
Big difference. And I know you do huge, unbelievable life-saving surgeries as well. So it is nice that you get to see it all. So tell us, we have a parent audience, tell us a little bit about kind of what is ENT in general and what parents might see an ENT for.
I think ENT is some of the most common stuff, some of the most common things that kids go in for, I mean, pediatrician visits or, specifically urgent care visits, right? I mean, maybe I'm the one taking tonsils out after you get 5 or 7 infections in one year, but like going in for a sore throat, a cough, runny nose or congestion, ear infection, ear pain, those are like at least the top 20 to 60% of primary care visits, and everything's so segmented these days. It's hard to get in to see anyone. So there's a lot of us taking care of things. I suppose I pride myself, or ENTs, we kind of pride ourselves on being like, the buck stops with me. Like if I can't figure out your ear, nose, or throat diagnosis, basically nobody else will. I find that if you have a heart issue, there's like cardio that you go see cardiology, but if you need a procedure, it's cardiothoracic. If you're seeing a medical oncologist, but you also see a breast surgeon, like those are different specialties. ENT, and then I guess ophthalmology, the buck stops with me for medical and surgical things. So, you're not always getting cut or having a surgical discussion, but there's typically like lots of procedures. These are like weird, deep spots in the body. So it really takes a lot of comfort and confidence to deal with them. So like the medical specialist, the surgical specialist. We live in a really rich area where there are some people who are very subspecialized in certain things, but just like a really good pediatrician, like anything that comes in my door, I'm ready to handle.
Yeah,
And that goes for
and you're right. Like a lot of times surgeons are not the ones necessarily, having to interact as much with the patients, but it sounds like ENT is different in the sense that you're doing the surgery and you have to have, again, that amazing bedside manner and working with all ages and just kind of helping them with whatever they're coming in for.
This is something my senior partner told me, who's like a really, really wonderful reputation. That's the fun in it. The fun in it is like, oh, you're a psychologist? That's wild. Oh, you're a social worker at a school? Like incredible. Because I am seeing these people like, every 3 months, every 6 months, every year. It's actually been
years.
I have not coped well lately because I see people every 6 months of all ages. Someone came in the other day, it was an adult, and she lost her husband 6 weeks ago. Since I last saw her 3 months ago, and I'm going to see her in another 3 months just to, keep an eye on things. Nothing crazy. No CAT scans, no surgery. But it's just amazing being a part of these people's lives from the get-go. And like, you can never realize that when you're in your 20s and 30s, maybe before you're married and have kids, that you're like, you're just in it. It's not a job. It's like a way of being.
No, it's really interesting. I never thought about that ENTs really have relationships long-term with a lot of their patients, maybe not all, but a lot in a very different way than any other kind of surgical background, profession would have. So it's really neat. And like you said, it's probably more rewarding and wonderful. And for someone like you, who's clearly a people person, it's a great thing for you to be able to have that relationship with the patients. But I'm sure it also, like you said, is hard, that of course you're sad when something happens in their lives because you really do feel connected to all of your patients. Yeah,
absolutely. We cover a few hospitals. We specifically cover Advocate Children's, and the amount of stuff in the neonatal ICU, the NICU and the PICU and all the crazy stuff. Maybe I'm getting ahead of myself. We had a 13-month-old last week who swallowed a button battery. So dangerous. It was in there for, an insane amount of time. Now they're tube fed. I mean, it's hard to compartmentalize that stuff.
Oh my gosh. Absolutely.
And I hope I never do, I suppose.
Well, yeah, that's a
we'll talk later.
No, but it's a similarity between the mental health field and your field, in the sense that we were always taught, you can't compartmentalize 100% or you're not going to have enough empathy and be a kind, caring therapist. You want to care, right? That's part of what makes you good at what you do. And like you said, you also don't want to be like waking up in the middle of the night in a sweat, thinking about people, because you do see a lot of traumatic situations, it sounds like.
And I do have a balance, and, I enjoy when I get to enjoy, but I hope I never lose that, or I hope people can tell, or,
right.
Maybe a part of it is just being a parent, but like, it's good for things to stick with you because that's real.
Absolutely. No, you wouldn't want to have none of that. That's for sure. So I know I got to know Dr. Teitelbaum, of course, through my daughter, who had luckily nothing major, but some minor ear issues, which of course are so much better now that we've had our surgery. But I'm curious for you, what are common, signs or red flags that a parent might miss if they don't know better, where you would say, oh, that child really needs to be seen by an ENT? And sometimes, the pediatricians refer, and other times I don't think they do. So
Yeah, that's an
parents
awesome
look out for.
question. Sometimes I see second opinions, sometimes I see first opinions, and they're like, oh, well, why wasn't this brought up? And it's
Mhm,
like, I don't know, sometimes things can be subtle. I
mhm.
think snoring can be subtle. Honestly, when I ask most parents, thinking about big tonsils, big adenoids that very likely need to be removed, they're like, I don't know, once I put my kid to bed, I don't check on them. And it's like, me too. Once they were like 2 or 3 and slept through the night, like, you're right, I don't go in there. Like, I hope I don't hear from them again till like sometime after 6:30. 7 if it's like a really, really special day.
Mm,
Um, the question is like, what's missing? I'm very serious about voice changes. So if a child is hoarse or an adult is hoarse, of course, adults have different types of voices, but like unexplained symptoms, like why is the voice raspy?
mhm,
Hearing loss, ear pain. Well, every time I look, things are good. Well, do they need not just a full hearing test, which we call an audiogram, but like sometimes I can't tell if there's fluid behind an ear because it's like cleared out. It's not like yellow amber, like Jurassic Park. When the dinosaur was all stuck. That's exactly what it looks like, honestly, when like someone goes on a flight and they don't clear. Um, but like we just test the eardrum just to make sure it's moving. Like I can't even tell, but I have audiologists in my office. Sometimes I work with very specialized speech language pathologists that can help. Rarely do we get scans on kids. One of the biggest things I do, which is a point of discomfort and probably fear coming to the office, is I do a lot of scopes. So
mhm,
what that is a 4 millimeter, seriously flexible fiber optic scope going to the nose, looking at the adenoids, looking for like polyps, and you can curve around and see the voice box.
mm,
It takes 10 seconds, 20 seconds. There's no need to be put out. There's no need for, sometimes I give spray, but it's really placebo, which is wonderful. Um,
mhm,
but like what are you missing? So for parents, I hate when kids are on too many antibiotics. Even if they're not getting C. diff or diarrhea, even in diapers, although a lot of them are, it's like, you're missing something, or the risks of surgery are not as much as the risks of like the chronic bowel issues, again, which is not my specialty. It's
mhm,
just yucky. Like it just puts me in the wrong
mhm,
position, not as an ENT, as a parent.
mhm,
So it's like, well, if you're concerned about something and you don't really have an answer, and let me preface, sometimes the answer is like, yeah, everything looks okay. Ears hurt not because of ear infections, but like molars are growing and kids are clenching and adults always are clenching.
mhm,
Um, so even just being like, yeah, everything's okay, like, we'll just keep an eye on it.
mhm.
Sometimes good news is good news.
Right. No, so even if, again, like you're saying, even if there's nothing found, it's nice to have peace of mind as a parent for sure that you've checked it out. And, if there is some sort of odd pain or recurrent infection, that at least, you've gone to a specialist who can say, yeah, that actually is within the normal range.
Yeah. Or like
And
I hear that all the time. I just had 2 patients this morning and they said that.
yeah, yeah.
I don't
No,
know
that
how
makes sense.
comforting that is. I try not to, one of my partners calls it tap dancing. Like, oh yeah, it's common to have ringing in your ear, not for kids. And sometimes we just da 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 da. I don't have spiels, and I sometimes wish I did because I find myself like unable to explain things. Although, of course, I don't use like big doctor terms at anyone.
Mhm,
Um, um, yeah, I don't know. It's like a fresh, sort of authentic perspective, and then that's what you need. And
mhm,
sometimes people do have like weird things and they're found on a scan. So they come to me and they've seen neurology and they've seen rheumatology and autoimmune expert. And I'm like, yeah, you did everything. Like I agree with everything you did. And like, I'm glad we did all that.
right, right.
But,
Absolutely.
you
Right.
know,
Still good to check it out.
yeah, it's still good to check it out. So I suppose I encourage the audience, like if you're
Mhm,
worried about something, if there's a family history, like all y'all had your tonsils and adenoids and tubes out and something's not quite right.
mhm,
We have really specific guidelines, I will say, for tonsils. Like when
mhm.
teenagers have tonsil stones, that's not a good reason enough to, you know, go through the pain and sometimes like a post-op bleeding risk of a full tonsillectomy. So
I was
even
gonna
having that sort of explained, can be a good thing.
I was gonna say, I feel like tonsils and adenoids, like, back when I was a kid, everyone had their tonsils removed. What is the purpose of those parts, and why do sometimes they get taken out and sometimes they don't?
Great question. So it's like a 3D ring of tissue. The adenoids are kind of like straight back, but really the part where the nose curves to meet the throat, it's like the upper throat. But I will say that's where your ears drain. So sometimes kids with big adenoids or like bad kind of chronically inflamed adenoids, they get like pediatric sinusitis, like runny nose, stuffy, mouth breathing that can affect the teeth. It can shoot up and affect the ears. So whenever we put a second set of ear tubes in, which I do not wish upon anyone in this chat or any listeners, sometimes we take the adenoids out, especially if the child is over 4. Tonsils, we're taking out more now for obstruction, sleep disordered breathing. And those ones actually peel out easier than the ones that have been like strepped and scarred and treated with antibiotics. The third most common procedure in America is tonsils and adenoids, and ear tubes is number 1.
Wow, I didn't
I'm
know
responsible
that.
for like 2 of the top 3. I've done C-sections, which is number 2 in the past, and it's like probably one of the most special things I've ever been a part of.
I could imagine. Yes.
Birth, and then what I do, like already 2 times this morning, people coming out of anesthesia. Those are the 2 craziest things I've ever seen. Because I'm like, do you remember that conversation we had? No.
So tell us about, well, on a very light note, kind of what's the weirdest thing you've ever had to remove from a kid's ears, nose, anywhere?
Awesome.
Yeah. And then I was going to say, and then I really want to hear about some of the more meaningful surgeries you performed.
So again, ear, nose, and throat is maybe an esoteric thing, because like if I'm not having like a scope or a microscope, you really can't see, beyond what you can see with an iPhone light, which it's fine. By the way, let me also say, like, that's fine if you look at your throat. I use Q-tips every once in a while. People can just do what they want to do, and they probably will anyway. But some things people can get a little intense about. The most fun thing I remember was residency was in Columbus, Ohio. So I was 45 minutes south, and I was very young in my training. So like looking at an ear and taking out a rock, a pebble in like a 5 or 6-year-old. Took it out. So proud of myself. The pro move, though, is to look back in and just like make sure the ear canal and eardrum are okay. And there was a second pebble. And I was like exclaiming to the room. I was like, I found another one.
Oh my gosh.
The other day, a kid at my son's preschool on the way to preschool, a really nice preschool in the area, put a bead in his nose, and they like went straight to my farthest office, and I like took it out, and he was a good kid, and the mom held him. I had a 10-year-old, very smart girl, put like a whole dime in her nose. It's pretty funny. A page of a book that kind of melted into the sinuses.
A what?
I will tell you, like,
what that melted?
Button, it melted. It was like mucus. It mucused into the. Yeah, sorry if you don't like mucus.
No, it's unbelievable. Yeah. Wow. And then
all my colorectal GI friends are like, "How do you deal with snot?" And I was like, "Really?
Right. It sounds better than the other.
Really?
Yes, I agree." And then I know you've done some really intense, meaningful, fulfilling surgeries. Sometimes, saving people's lives. Can you tell 1 or 2 of those anecdotes?
Sure, of course. So sometimes when people can't breathe from above, like if they're in a car accident, I'll do like an awake tracheostomy. I once did that on a prisoner, actually, who had like a head and neck cancer that went too far unlooked at. This is a pretty random one, but sometimes a bad ear infection, not the same as getting chronic ear infections, can like go to the brain and cause meningitis. So I was at a Mother's Day 5K and with my wife and kids, and I was on call, my second Mother's Day in a row. And I literally just like ghosted. I was like, I have to go. And I went and put an ear tube in a girl with meningitis, and she was like better the next day, and like amazing when I saw her a few weeks later, just to get that drainage.
Wow. So how did they discover that? How did they figure that out? That connection?
Great question. She was like sick, like fever,
really sick,
like really sick, like hard to wake up. This might be a good topic for your listeners, but like, I see a lot of people who think they have brain tumors because they're like dizzy or vertigo or ringing, and it's a pretty rare thing, but it never hurts to check.
No, it never hurts to check. And then tell us about, again, the brain tumor surgeries.
Yes. So, as you know, as much as I love seeing kids and adults, and like one of the proudest things that I never knew, because how could you tell someone this in like med school or like overnight call residency, is being a part of our community, just like you and your team are. Although I guess we're both constrained by HIPAA and stuff, like, just being there for people, and yeah, staying late and squeezing them in, or having a conversation, connecting about, you read my bio. It used to be like, oh, my step one score was this and my MCAT was this. And, when I took like the in-service exam, I got this. And now I'm like, yeah, no, I love football and baseball. And I'm taking my daughter to see Beauty and the Beast downtown. I heard it's magical. Like I'm not even seeking this out. People keep telling me how great it is. They don't even know I'm going. So just like, ear, nose, and throat. I don't take vitals. I don't take blood pressures. I barely look at people's medications. It's wonderful when pediatricians do that. It's wonderful when you and your team have, the bandwidth, sure, but the opportunity to like really take a look. And I do try to be pretty holistic or gentle for a surgeon. It's actually a pretty cool way to do things. Just really like making that connection in just like 6 or 8 minutes, because like people just want to talk and be people and stuff. And, we're all very similar, even though we come from different backgrounds. So anyway, one of my subspecialties is advanced sinus surgery, and using the sinuses to get to the undersurface of the brain. If you can like picture the frontal lobe and the pituitary gland and even the top of the spine, and even going to like the tear duct or the eye through the nose. Like again, all the nasal surgery I do, there's no bruising, there's no change, there's no packing. That's what everyone thinks. And they're always so happy and surprised, even though we had that conversation. By the way, studies show you only remember 30% of like your pre-op conversation with a doctor, like, informed consent aside, like, what was it? Like, do I need to do more handouts? Do I need to put more stuff on my website?
People
like,
is it just because people are so stressed and nervous?
Probably, or it's just like the nature of the beast. You're just like, okay, like, great,
Yeah.
all the more reason to have like a trusting relationship.
Right. Absolutely. So
that's something really, vibes. I mean, I think you and I are a little beyond that era, I'll say. But it really is important. I mean, especially to people and patients, it's important to me.
Absolutely.
It's important to me when I see someone, or when I take my wife to see someone, or we take the kids to see someone. I mean, you should connect. And we're lucky enough that we live in the Chicagoland area.
Right.
And again, that's authentic. So anyway, I pretty often I take out tumors and like patch things up with tissue in the nose. Today, I did 2 really crazy sinus surgeries. One was a very young person, a tooth root in her sinus, like pus just like pulsing out at me. But she's going to feel better. She feels better already. Yeah. And then another was a 16-year-old who's like allergies, asthma. He's been on allergy shots and he just didn't improve. So I sort of made more room in his nose and sinuses.
Wow. So
I know that Thursday I'm seeing a patient. It's an adult with a pituitary gland tumor that my neurosurgery colleague has. And by the way, I'm like a specialist. Then I'm subspecialist for that, and makes me work with other people more.
Right. Well, that's probably also nice to be able to collaborate with the other.
Very neat. Like you never really get to see other surgeons. I missed that when I was a med student. I would like, I don't want to gross out the audience, but like, I would stay late for like feet that needed to be taken out, because that was like something I could do, because you can't mess anything up.
Right.
But I I was single and no kids, and I stayed late, and it was like really fun. And that drive is the reason I'm sitting here with you today.
No,
it has nothing to do with my board scores. It was just like, I want to like be the best I can. And
absolutely.
I don't know. It's just more than a job.
No.
So anyway, I have a patient coming in. She's an adult, and our group does not take adult Medicaid. So I do like, 4 or 5 or maybe more of these cases pro bono every year. And our group is in private practice, and a lot of people are getting bought up, or they're sort of owned by the hospital, or they work for the hospital. So, I raise my hand at our group meetings, which are business meetings, right? We're all co-owners of ENT Specialists of Illinois. And I was like, is it okay if I do this? And everyone's like, yeah, that's so great that you're taking care of that patient.
It is. It is. And again, rare, I'm sure in this day and age for people to volunteer to do that on their off days, especially when you have a family and other hobbies and things you'd like to do. But you can tell just your heart is clearly in this for the right reasons. And, it's so rewarding to be able to help people who are underserved and would not get these services otherwise.
Couple other stories.
Yeah.
I do a lot of nosebleeds on kids. So kids have like
so these are with kids
vessels.
who are constantly like having nosebleeds.
Yes. So like going to the nurse's office is not dangerous. They're not like losing blood anemic, but like they're disrupting their school day, and it's usually worse with exertion. So
absolutely,
whether it's like dance or tackle football, like that's still something that
it's disruptive for them. Yeah.
It's disruptive. It's a nuisance. But like little kids have like little big blood vessel hoses. So we just like numb it up in the office, and I just kind of paint it with like a little silver nitrate stick.
Mm-hmm.
And then sometimes 8 weeks later, when that heals, because you never want to do both sides at the same time, I'll go back and do the other one.
Wow.
So silly.
Like usually they're done for life in terms of nosebleeds?
Pretty much. Or at least it's like never severe. People always tell me, it's like a murder scene. Like, parents are just.
Oh, yeah. I can imagine white couches everywhere. It's definitely not good.
That's right. It's like, oh, it was picture day and she was in her dress. I was like, yeah. That's a problem.
No. So,
you can always try moisturization,
Right. Well, and I know you try. I think you're very conservative in the sense that you will try the things first before just recommending surgery to any parent, which again, as a parent, I think is appreciated.
It has to be like that with kids.
Yeah. But then you also clearly are able to move into that realm when it becomes obvious that that's what's needed.
Yeah. I guess maybe that is a take-home message too. It's like this risks and benefits thing.
Mm-hmm.
But if the procedure like ear tubes or adenoids or nasal cautery done right and done, with the right timing and for the right indications, which is like a medical term for like, why are we doing this?
Right.
7 strep throats a year, can't get off antibiotics without it.
Right.
Then things tend to go well.
Right.
Absolutely. But I understand that's anxiety provoking.
Well, I was going to say, so thinking about, not that adults don't get anxious before procedures, because they certainly do, but thinking about kind of when you're with children and they're going to have a procedure done by you, what are some of your go-to tips for helping them stay calm, for just kind of reassuring them that things are going to be okay? Because I do know that kids have a lot of anxiety prior to medical procedures.
I'm sure they do. I'm sure they do in the office too. And then I, put the camera in their nose and like somehow the next time I see them, they always high five me anyway. I will say they forget pretty quick.
Mm-hmm.
And I will encourage parents, like it's really important to get the answer the right way. Does that make sense? Like,
yeah. Oh, for sure.
Sort of like, not like, oh, let the provider do their thing. It's just like,
well, that's
if I don't do certain things, no one will.
No, I was going to say that's actually good for our audience in the sense that parents, right, do have a choice when they're in the waiting room, or not in the waiting room, in the doctor's office with you and their child, in terms of kind of how they handle the kid's anxiety. And so if a kiddo is hysterical and the parent's like, oh, no, we're not going to do it. Forget it, Dr. Teitelbaum. Like, we'll just do it another time, which I can imagine happens. Then you're just kind of postponing the inevitable because, the problem is not going to go away. You're still going to need to check it out the next time. So, there may be some kids who require more time with you to get more comfortable. But I was going to say, if the parent kind of like can relax a little bit and allow you to be the lead, your bedside manner with kids, again, is so good that I do feel like the kid will be like, oh, mom's saying it's okay. And they'll trust you. And like you said, the thing goes in and out in 10 seconds and it's like a shot. No one loves it, but they'll be okay.
I hold 2 of my 3 kids down every late August for their flu shots. I do.
Yeah.
It's just,
I
guess. So for the parents first, like put yourself in my mind frame. It's like, hey, I just got to do this really quick. I hate that I'm doing this. Although I will, write a note on my little dictate on my phone and move on. I do think a lot of it is modeled by the parents. If they're hanging out and they're chilling, and I am sort of the same age as a lot of these people, though. A lot of these parents are a lot younger than me all of a sudden.
Oh my gosh, you're younger than I am, so I don't know about that.
Possibly true, but like it just generation to generation, like these kids, my little siblings, little friends are having little kids, just like I did 5 or 6 years ago.
Absolutely,
it's pretty funny. It's always constant reminder. modeling and sort of being casual. I will say, basically besides a 1 or 2 year old, whenever I see a child, I talk to them. I think it's awful, especially with like translators, and we can get to that. It's like, oh, tell him I said this, or we're going to do this. Like, just sort of like engaging, like I would with any patient, and being like, okay, here's what's going to happen. Here's what I'm looking for.
Right.
Setting it up like it's going to cause this. There might be this.
Right.
And that takes 10 seconds. And again, I think in this sort of tricky world of healthcare, when it's so timed, and I shadowed people in med school who time themselves with each patient.
Yeah.
Not specialists, like a family doctor. You're supposed to be able to tell them everything you want and get all your answers answered, all your questions answered. I was with my daughter at an eye doctor appointment, and the eye doctor, who is a colleague of mine, she said, I have to go or my staff's going to be like upset. I don't have any time for more questions. Oh. And I was like, I can't believe you just said that to my daughter or me, or like me.
Right. Absolutely.
I was like, I can't believe you actually said that. You could have like implied that. You actually said it. Right. So anyway, make sure your questions are answered. And then if your kid's upset, like call back later, or like, when they leave the next morning, like call your doctor, talk to the doctor, or the nurse or PA or NP, and like really get things answered. I'll tell people to like look things up, and I don't want to say like talk to their friends, but like, watch a video and then call back if they have questions, and most don't.
Right.
So anyway, something I think I pride myself on with kids and with parents and in tricky situations like that is just taking the extra time to use my voice.
Mm-hmm.
When you take Flonase, it can really dry your nose out and cause nosebleeds. The tissue that you're trying to hit is straight back and to the side. That took 8 seconds of my time, right? People spray it like this. They spray it at their septum. They get nosebleeds. They get rawness, and they don't get improvement in nasal inflammation and nasal allergy.
Right.
So sort of like over-explaining is something.
Yeah. And kind of helping kids know, and the parents know what to expect, what are common things you might notice, right? Just so that they're prepared.
Yeah. I do find people in our area, and probably your audience and your
Absolutely.
patients and clients are pretty educated and stuff, but like, I don't know, maybe they don't know.
Right. No, it can't hurt. It can't hurt to share the information for
Agree.
Sure.
Well, then I encourage parents, and kids who are of age to also speak up and ask questions and stuff. I will tell kids, I'm like, hey, it's your body, which is a very like new age type thing. I'm like, you can say no to this if you want. Especially like the 10-year-olds and 12-year-olds and stuff.
Right. No, that's really interesting.
Lee, even just seeing kids, by the way. So like, 2, 3, 4-year-olds, like that's very different than like a 7, 8, 9-year-old, which is very different than like a hockey player 15-year-old who like, has broader shoulders than I mean,
absolutely.
That's all pediatrics. Like, no. I don't know. Those are 3 different things.
Absolutely. No, they're all different. And honestly, how to connect and build rapport with each of these based on their developmental stage and based on, kind of their age, all of it. And so I know with my daughter, you kind of connected on the dance studio lingo. I thought it was so funny that you knew the different names, and she loved that. So
thanks.
Yeah, you have a natural ability to put the kids at ease and the parents at ease also. And again, I think it's really a gift. So I'm trying to think before we get to kind of my last couple questions. If you want to share any other sort of success stories, and it doesn't have to be like the brain tumor category, but just kids who or adults who've had chronic pain or chronic hearing issues, kind of some of the more routine surgeries that make a big difference.
Absolutely. I really think they do. There was a very nice patient. So, probably similar to you, but growing up in this area, even though I was out of state for a lot of my medical training and my wife is not from around here. Even my 2 daughters were born out of state. Obviously, they're here now. So anyway, there was the dad of this really, really cute 4-year-old that I know. She came in and I scoped her, and she was very upset, and she like hates taking medicine. She's got horrible allergies. And she's got like some nasal obstruction, runny nose. So I looked at her adenoids. It's pretty normal to still have tonsils and adenoids. They usually shrink up around age 6 or 7. But they were pretty big. And I thought, if anything, they were just causing more of a problem. So we took her, for a 10-minute procedure, but, I took her away. By the way, no IV for kids that age, but like, we masked her to sleep and she was not happy. IV breathing tube. I shaved her adenoids down. You don't really take adenoids out. And then the next time she got sick, because she's still going to get sick, right? I mean, surgery is not always a cure for things. She didn't get like a swollen eye like she did when she had like a reaction to sesame seeds. Like it wasn't perfect, but it was like, oh my God, she was better. And I was like, I didn't even think those things connected.
Wow.
And the mom's like, I didn't either. And I was like, cool, glad she's doing great. And she drew me a picture that I saved with like all my little stuff. And I moved on because it was a success story.
Yes.
Right. You get 1,000 compliments. You only remember the one thing. I wish I like did that bite into that sinus. 2 things I could think of from this morning. That was really exciting. I had a patient, and maybe you see patients like this, nonverbal autistic, 13-year-old. Had a history of like tubes, adenoids, allergies. Probably a lot of the audience knows these like ENT kids. And he just kept clutching his head.
Oh.
He kept silently clutching his head. That was new. Is he a little stuffy? Sure. Is he a little runny nosy? Sure. Chicago allergies. And I think I'm guilty of saying that to patients. Says like, oh, you have allergies? Like, oh yeah, like allergies. But maybe that's good to hear. You never want your symptoms sort of like placated, but if they're like kind of run of the mill, then maybe it's good to hear that they're run of the mill. And then it's one less thing to worry about. I do have a story about worry in a second. So anyway, he had an MRI and it showed like something deep in his sinus, the sphenoid sinus underneath the brain, right before the pituitary. Saw him, said, I could take it out, but I'm not sure if it's going to cure sort of the headaches. And I made a little more room in his nose on the way back. I sent him for a second opinion to like the head of Rush, ear, nose, and throat rhinology, who was like, sure, it might help. And I told the parents the same thing. Then I saw him back and did the surgery. And I didn't know what this thing was. I didn't know if it involved the brain. And he did better, not perfect, but better. But it was such a tricky situation.
Oh my gosh.
That's very tricky too, ear, nose, and throat. So a lot of ear stuff can be like molars and teeth. A lot of headaches. Yeah, you have sinuses right here, but more often it's like a headache or migraine, especially if there's a history.
Right.
Family, it's so tricky. Again, sometimes figuring out what's what and what's not. And sometimes people are happy to hear that. And they're like, well, if it's not that, what's that?
Right.
That's tricky for me.
Oh, absolutely.
Those are some good stories. A tricky story. So I was doing tonsils on a girl who was sick all the time and snoring all the time. She was 10 years old. Her mom is a therapist.
I might know her.
And she asked me right before surgery and like pre-op. I was like, hey, good to see you guys. Like, what's up? Like, how you feeling? I'm sure you're hungry, right? Can't eat anything before surgery. And she just says, am I going to die when I'm in surgery? Am I going to wake up?
Oh.
And I don't think I was prepared for that. And I kind of gave almost like a cheesy answer, like that I wish I did better. I was like, oh, honey, like, of course type thing, I mean, I could see my children in her. And even if I couldn't, I do, right? Because just being a parent definitely makes you a different, everything, the way you function in the world. And everything went great. But I was like, wow, I didn't even know you were thinking that.
Absolutely. Do you tell the parents if something like that seems clinically significant to me? Like, she's a worrier, right? If she's asking that kind of question, I would imagine, I shouldn't say that. I would guess.
Yeah.
Do you tell the parents if it's something they weren't present for? Because it was
they're there in pre-op every time.
Oh, they were there.
Right?
Okay,
yeah,
good.
great question.
Yeah, because
maybe like if I say something funny under anesthesia, I'll tell the parents. But like that's our time. That's actually a really important like doctor points. Like when you're having like a consult, even you're silly, you're joking around, you're talking about fantasy football and Beauty and the Beast and all this stuff, and sort of the dance studio gossip of the week. And there's a lot of it. Like that's still your time. It's like, I tell people like, look things up and call me back, but it's like, this is our time face to face, especially in this era, like telehealth and like, we return phone calls. We don't have a patient portal and it's never going to get set up.
Which is nice.
Message your doctor. It's okay. Hey, I just want to tell you I'm this, I had a little this, fine. But like, if you're, going into surgery or you're having a conversation about something like that, even if it's routine, even if it's adenoids and tubes, okay, like they can basically go back to school 2 days later and full activity and stuff. Like that's your time to sort of like put everything out there. And yeah, ask sort of the silly questions and like talk about your anxiety. I don't know.
Mm-hmm.
Like let me know. Like more information is better.
Right. It also sets up a template for the child for future anything medical related, future doctor that it's okay. You're open to questions, that you're willing to sit with them a little bit extra, and take their concerns seriously because, again, someone has one bad doctor appointment when they're a kid. And unfortunately, sometimes that's what they remember. They might have had two or three great doctors, but they have one terrible visit and like they don't want to go to the doctor anymore. And so even though, it may be something benign, it's nice that you can kind of like reassure them, sit with them, kind of make them feel more comfortable. Ultimately, I don't know that would have been the right foray for saying, well, we all die sometimes, right? No, reassure the kid that just trust me. I do this every day. This you're going to be
got
great.
more of this, and you're going to go home and eat lunch, and sort of normalizing it. I hope that was an adequate answer.
Absolutely. Whereas
I will say, as an ENT, I'm usually people's first general anesthetic, right?
Yes.
If it's a baby or a 5-year-old or a 17-year-old just getting like a deviated septum before you go off to like the moldy dorms or whatever, like.
Right.
It's very normal to be anxious. I mean, again, if you're waking up in the middle of the night, there's a difference between, if I was having like a colonoscopy, I'd be, nervous the day before.
Absolutely. No, but it sounds like, again, you are aware to kind of, be there for the kid, for the family, for the parent, that you have empathy towards what they're going through, and you don't make it so serious and scary, that you distract them, that you show them what the video looks like up their nose, that you're able to kind of have a lightness and a levity too to your approach, which does put them at ease.
Well, thanks. I think that's, what I tell patients or parents, and obviously thanks for the kind words. I'm like, that's just the way my mom and dad raised me. Like,
lovely. Absolutely.
I'm glad I get to be there for people. Totally on topic. I was an English and theater major while I was pre-med at Michigan. I always wanted to be a doctor, and then I always wanted to be an ENT. But I was like kind of copy editing some personal statements, and one of my friends applied to emergency medicine. And I was like, the ER, like, treat them or treat them, right? You're in or out. And he made this point that I'll never forget. And again, I miss sawing off people's toes. Sorry, audience. I miss like the other stuff. Like I rotated in psych and pediatrics, and it was that I loved it all, which is sort of what makes me me. But I kind of miss that other stuff. So when you're in the ER, it is sometimes like life or death, or you're about to get a diagnosis. And he's like, I'm there for people in that crazy moment. I might never see them again or hear from them or get like a page, but I was like, oh wow, like, yeah, I don't know. There's so much like perspective and empathy is the word, but I guess that's what people should look for is sort of someone who can connect on that. And maybe the odds are if you connect like anyone who's reading a book, like while they're waiting for me instead of on their phone,
It's awesome.
I'm like, what are you reading? I got some novels and
I'm like, I don't know how you had time to do theater, English, pre-med. That's not easy.
Love of the game.
Yeah. What was your favorite performance you ever did?
Wow. In high school, I was in the Laramie Project about Matthew Shepard. That I'll never forget. But the best thing I did was at Michigan. It was student run, student directed, and produced the complete works of Shakespeare abridged.
Wow. Incredible.
Incredible. I miss it, actually.
That is.
I'm looking for some community theater opportunities. It's time to get back into it now that our youngest is.
I mean, so cool. I don't know how you're going to have time for that, but it is so cool.
I'm going to be like, I'm Dr. Jordan Teitelbaum. I'm board certified. And here's my rendition of this. I don't know.
And start tap dancing. I love it.
Again, so they're like.
It's awesome.
Sort of being a person. And then like people come into your office and they're just people. Like they just want to be okay. And
absolutely.
They just want to be there for their kids and they just want to feel better. They just want answers, or they again, off topic, on topic. Somebody told me she was like a really cool VP of sales. She told me she got long COVID from getting vaccinated. I'm not an expert in that. And I said, I believe you. I'm really sorry that you're going through that. I know this is like not the real you. I don't know. And I'm not commenting on the science about it.
Right.
Why would I not believe her? I wasn't treating her for those conditions. I was treating her for an ear, nose, and throat thing.
Right.
And again, that was something that stuck with me. I was like, oh my gosh, she like really doesn't feel great.
Right. Absolutely. Absolutely. So before we end, I just want to ask if you have any like favorite resources, whether they be podcasts or websites or books for parents who might want to learn more about any of these ENT related topics that are more related to kids.
I like reading Google reviews and I like Facebook and Instagram. The Academy of American Otolaryngology, Head and Neck Surgery, whatever, AAO, they have a website called enthealth.org. There's like
ENThealth.org. Okay.
written for everyone, and I've written some of these articles actually. It's like, well, what is this and what are the symptoms? And very importantly, well, what should I ask my doctor? It's really cool, actually.
That's
what
really
FAQs are your FAQs?
Mm-hmm.
And then there's stuff like Be ENT Smart, like how do you get ahead of spring allergies?
Mm-hmm.
And ENT is kind of interesting, right? You go to like Walgreens, CVS, Target, and there's like a whole aisle of stuff. And it's like, yeah, I mean, most people probably do start with that stuff. And God only knows like what people don't tell me. I probably don't want to know, to be honest. But like, that's very interesting, right? Everyone has an ear, nose, and throat, and everyone kind of gets like allergies and sore throat and like weird ear things and something stuck in my throat voice. Happiest patients when I look and I'm like, everything looks good. They're like, see you later. Because if you don't have risk factors, you don't have risk factors.
Right.
So I really like our Academy website. There's like little helpful tips. There's a ton of pediatric ENT on there. ENT is just such a common thing. Sometimes if you see a doctor, they have a practice website,
Mm-hmm.
like their, group's website, and it's like common pre-op instructions. When can my child start, not eat and drink before surgery? And that's always scary. What medicines should you stop?
Right.
Usually stop things like Motrin, ibuprofen for 2 weeks because it can thin the blood a little bit. Like, go to that source. Yes, definitely. Like, you can read reviews and glean things personality wise. Where do you want to go? But once you're like locked in and you have a diagnosis and a provider, like they should have the information for you.
Mm-hmm.
And like the Academy has the information, they have recommendations. And I think knowledge is power. I like when people Google things and they come in with like vertigo, which is maybe more of an adult thing. Vertigo in children,
Mm-hmm.
never very, very normal. Like they're like, oh, I read about the crystals and I read about this. I'm like, good, because now you and I are starting up here to talk about it rather than me being like, well, there's a couple parts of the throat, So I don't discourage people from talking about the things that they've looked up. And, I'm sure they have ideas and I'm sure they have iPhones or droids and they have their own notes. It's like, sure, go in with that information, like, because then you can have the next level discussion.
Mm-hmm.
When you're talking to someone who does this and has seen this and is up to date and, board certified.
Absolutely. Absolutely. No, you're such a good resource.
Thanks.
You.
I'm working on my own coping skills.
Yeah, no. Again, I think you need to have a clone of yourself so that you can be tap dancing and spending time with your family and reading Shakespeare on the side and doing these amazing life-saving brain tumor surgeries. Unbelievable.
Well, thanks. It's really nice to know you. I mean, again, I think I like helping people who help people, and I always say that to my patients. Not that your audience who are CFOs shouldn't be listening, but like nurses and therapists and PsyDs and PhDs and teachers.
Mm-hmm.
Oh my gosh, teachers. I have like a backlog. Like, we need to get this done by August 18th, all recovered and back to work.
Right.
Or school, because mom's a teacher. And I was like, I don't know, just that compassion and pride and sort of like taking it on myself, which is like kind of a heart too big, can get hurt sometimes. But then I'm like all cool and, like bossing the nurses around and doing surgery and stuff. So
yeah,
there's a lot of duality.
Absolutely.
I mean, thank you so much for your kind words.
Absolutely. Well, thank you so much, Dr. Teitelbaum, for sharing your time and your expertise with us. Everyone, please check out more episodes of our podcast. Go to copingpartners.com and click on podcast and articles. And we will have in the notes how you can look up Dr. Teitelbaum and his website and all of his information as well. And thank you as always for tuning in.
Thank you for listening to the Coping Podcast. We'll see you again next time, and be sure to click subscribe to get future episodes. And check out our podcast page at copingpartners.com.